Hello, my name is Sydney Hall, and I am a Wellbeing Ambassador at ECU Campus Recreation and Wellness. Today we are going to discuss ways you can have safe sex in intimate relationships. After this program, you will be able to identify at least 3 ways to prevent unwanted pregnancy and STIs, explain how STIs are transmitted, diagnosed, and treated, understand the impact alcohol can have on one's judgment regarding safe sex, and learn about resources on campus related to safe sex practices. What do you think of when you hear safe sex? Some common responses are using condoms, taking birth control, avoiding alcohol before sex, consent, getting tested for STIs. Safe sex greatly reduces the risk of unwanted pregnancies and STIs. Some things that may come to mind when we're talking about safe sex are the use of condoms, the use of other contraceptives such as birth control, and getting tested regularly. Abstinence is refraining from sexual activity. This is the only way to 100% ensure you will not have an unwanted pregnancy or transmit an STI. This image shows some birth control methods. We won't go into detail of every single one, but it is important to know that there are many options to keep you and your partner safe while having sex. It is important to meet with your primary physician to talk about what method is best for you. Each method has a different range of effectiveness. For example, use of a condom effectively reduces the risk of unwanted pregnancy anywhere from 82 to 98%. Take a moment to think about why there are different ranges of effectiveness. The reason is because the condom must be put on perfectly to have the highest effective rate. If the condom is put on incorrectly, it will reduce its effectiveness. Another common birth control method is oral contraceptives. This is the pill some women take daily. Oral contraceptives, like the pill, effectively reduce the risk of unwanted pregnancies anywhere from 91 to 99%. If you skip or miss taking a pill or pills, or don't take the pill at the same time every day, it can reduce the effectiveness. As you can see from the picture, there are many ways to reduce your risk of unwanted pregnancies and STIs. It is important to note that abstinence is the only way to prevent contracting an STI transmission, and preventing unwanted pregnancies. However, if you plan on being sexually active, the best thing to do is use a male or female condom. Oral contraceptives, IUD, and other listed methods prevent unwanted pregnancy. Again, it is best to speak with your primary physician to determine which methods are best for you. I will now walk you through the steps on how to properly put on a condom. The first step is before starting to put on a condom, it is necessary that both individuals give and receive verbal consent. Consent is freely given and reversible, meaning someone can remove consent at any time. You must be sober to give and get consent. Before engaging in any type of intercourse, it is important to practice good hygiene, so make sure you and your partner wash your hands. Next, check the expiration date of the condom. Make sure the condom is not expired or had any visible damage to it. Open the condom package. Do not use your teeth or scissors. Open the package carefully to prevent any damage to the condom. Next, make sure the condom is ready to roll the correct way. The rim should be on the outside and look like a hat. It will unroll easily. Pinch the tip of the condom to squeeze out any air and leave space for semen. Place pinch condom onto the top of the penis. Unroll the condom all the way down the shaft of the penis. When you are finished, hold the rim of the condom and remove the penis out of your partner. This will prevent any semen from being let out. Be sure to fully remove the condom and dispose in the trash can. We will now watch a video on how to use a condom effectively.
Okay, so we have regular size, extra large, latex free, thin feel, intense feel. Okay. Strawberry wait a minute. Why do they need a strawberry flavor balloon? Someday, what may seem unbelievable now will likely happen. Someone will agree to have sex with you. Congratulations. Hey, didn't you forget something? Yes, that's important too, but I'm talking about condoms. It's a good idea to use condoms when you have sex. Condoms are an effective method for preventing pregnancy, as well as HIV and other STDs. Okay, I see that you need some help. Let me give you some tips on how to properly use a condom. Check the expiration date on the condom package to make sure the condom isn't expired. Open the condom package. Never use your teeth, scissors, or any other sharp object. You may rip or cut the condom. Before sex, take out the condom. It should look like a little hat. Then hold the tip of the condom to remove any air, and then roll the condom down to the base of the erect penis. The condom should roll easily. If not, it may be inside out, and you should throw it away and get another one. Use each condom for only one sex act. After ejaculation, withdraw the penis while it is still erect. Hold on to the base of the penis to keep the condom from falling off. Remove the condom, tie a knot in the end to keep the semen inside, wrap it in a tissue, and throw it in a trash can. Condoms come in different shapes and sizes. There are also different colors and textures. It's important to find a condom that is comfortable for you and your partner. Some condoms have lubricant to make them more comfortable during sex, while others do not. Non-lubricated condoms can be used with water-based lubricants, such as commercial lubricant you can buy in the drugstore near the condoms. Never use Vaseline or other oil-based lubricants, as they will break down the condom. Condoms can be purchased at many stores, including pharmacies and grocery stores, and even in some gas stations. There is no minimum age a person needs to be to buy condoms, or maximum. So, if you're lucky enough, the first time you have sex won't be the last. Remember to always be responsible, protect your health and that of your partner, and always use a condom. Oh, this is the last time I send Jim to buy balloons. Till next time, don't forget.
We've talked a lot about how to prevent getting an STI, but how are they transmitted? Infections are passed through sexual contact, mostly through the exchange of vaginal fluid, semen, or blood. If you are sexually active, you put yourself at risk. If you are sexually active, it is important to get tested. Even if you do not see signs of symptoms, you could still have an STI. Testing can be done through a physical exam, blood, urine, saliva, cell, or tissue sample. There is no single test for every STD or STI. Tests are specific to each infection, which means if you want to get tested for multiple STIs, such as chlamydia, gonorrhea, and herpes, you will need to request each test when you visit the doctor. Some STIs are curable, and others are manageable. Curable means that with treatment, the infection goes away. Manageable means there is no cure, but you can treat the symptoms. An easy way to remember what is treatable and curable is thinking about the 4 H's. Hepatitis B, herpes, HIV, and HPV are manageable, meaning there is no cure for them. Syphilis, gonorrhea, chlamydia, and trichomoniasis are curable. Take a moment to think about why is it important to communicate. It is important that you get consent for your partner. Consent is getting permission from your partner on what sexual acts they want to engage in without any coercion. When you're about to have sex, everyone must want it. Be willing, be sober, and be awake without force or coercion. It is okay to say no. Consent is not permanent. You can give consent and take it away at any time. Here at ECU, if consent has not been given or has been removed, any sexual act would be considered rape. The state laws of North Carolina regarding rape and sexual assault are different than ECU. For more details, you can reach out to the Victim Advocacy Services. Communication is also important when talking to your partner about STIs and birth control. Since most STIs are asymptomatic, you may want to know the last time your partner was tested and what the results were. It is important to talk about birth control methods because methods like the pill do not prevent STIs but can be effective in preventing pregnancy. Communication is also important so you can be sure that you and your partner enjoy what you are doing and that it's fun for both of you. What are some examples of unsafe situations regarding safe and alcohol and drug use? Let's talk about how alcohol and drug use can impact practicing safe sex. Think about the ways alcohol and drugs can influence your decisions and behaviors. On the slide here, we have listed some situations that could cause sex to be less safe. Binge drinking can impair your judgment, which can lead to making decisions you wouldn't normally make, such as going home with someone you don't know. Leaving your friend group without telling them where you're going. Not using condoms. Not watching your drinks, and mixing alcohol and drugs. It is important to remember having sex can be fun and safe. Avoid mixing alcohol, drugs, and sex, and make sure to communicate with your partner on ways to keep you both safe. In many ways, ordering pizza and consent are similar. When we order pizza, we want to make sure that everyone involved is going to have a satisfying and fulfilling experience, which means we have to have a discussion and come to an agreement. We have a conversation and actively collaborate on what is satisfying for everyone. Consent is an informed, knowing, and voluntary agreement to engage in sexual activity. Consent ensures that everyone is excited to be there without the risk of violating one another's safety, trust, or comfort. Just like with ordering pizza, we want to make sure that the experience is going to be satisfying and fulfilling for everyone. Consent involves having a conversation and actively collaborating with everyone involved to ensure that everyone is going to have a fulfilling experience. Create a pizza that you and your partner would all enjoy and be able to eat. The steps are: figure out if you and your partner are hungry. For example, asking, "Hey, are you hungry right now?" Or "How are you feeling?" Step 2. Figure out if you or your partners want pizza. For example, "How do you feel about having pizza?" Step 3. Figure out what type of pizza you and your partners like and discuss what type of pizza would be satisfying and fulfilling for everyone. For example, what's your favorite kind of pizza? Is there any specific type of pizza you don't want? What toppings would you like? Step 4. Figure out if you and your partner are ready to order the pizza. For example, do you feel good about this? I would love to do this with you, but I want to make sure that you're excited about it as I am. The Student Health Center offers STI and pregnancy testing at a discounted price. You can also get condoms, lube, and information regarding STI testing at the CRW Wellbeing Center. I have listed the links of the websites for these resources if you'd like to get more information. Student Health Services, Campus Recreation and Wellness. Lastly, here's a picture with informing regarding KISS packets. These packets include lube, condoms, and information on condom use. You are more than welcome to pick up a KISS packet in the CRW Wellbeing Centers. Here are references. And I wanted to remind you to remember the 3 W's. Thank you for listening to this presentation.